Hello students, I am Dr. Sachin Kapur and I wish you a very warm welcome to this section of Zoology lectures. The topic of our discussion today is male reproductive system. Male reproductive system consists of the primary sex organs, that is testes, and the secondary sex organs, epididymis, vas deferens, seminal vesicles, prostate gland, corpus gland, and the male copulatory organ, penis. As I said, the testes are the primary sex organs. That means these are directly involved in the process of gamete production or the gametogenesis. Production of the male gamete, that is sperms, is spermatogenesis. Secondary sex organs are not directly involved in gamete production. These are involved in maturation of gametes, transportation of gametes, storage of gametes. So they have no role in the production of gametes, right? They are responsible for maturation, storage, and transportation, or you can say that they assist in reproduction in some way. Let's first discuss about the primary sex organs, that is testes. Testes are also mixed tissues like ovaries. Testes, they are performing gametogenic function as well as endocrine function. Endocrine is referring to the secretion of the male sex hormones. When you say the male sex hormones, the category is androgens. Andro refers to males. Androgens are steroids. Androgens include testosterone, which is one example of androgen, dihydrotestosterone, androstenedione. So these are androgens. So testes are producing the male sex hormones as well as gametes. Testes in most of the mammals are extra-abdominal. Now when you say extra-abdominal, what does that mean? Extra-abdominal means testes are located outside the main body cavity in a pouch-like structure which is called scrotum. So this is the structure of scrotum, right? Testes are located outside the main body cavity in scrotum. Why? Because sperm production, maturation, and storage requires 2 to 3 degrees lower temperature than the core body temperature. So in majority of the mammals, testes are located outside the main body cavity. There are some mammals in which testes are located inside the body cavity, like prototherians or the monotremes, which are egg-laying mammals like duckbill platypus, spiny anteater. Then even in case of elephants, dolphins, whales, testes are located inside the main body cavity. Testes are intra-abdominal. In case of humans, testes of the male baby are formed during 7th to 8th week of pregnancy. The testes of male baby are formed during 7th to 8th week of pregnancy, and at that time testes are intra-abdominal. As the pregnancy advances, testes migrate to scrotum during 7th to 8th month of pregnancy or at the time of birth of the baby. Sometimes testes are not in the scrotum even at the time of birth of the baby. That clinical condition is called cryptorchidism. So what is cryptorchidism? Failure of testes to descend into the scrotum. It can be unilateral, it can be bilateral. Then what to do? The doctors will advise that we can wait for a few months or say 1 or 2 years. The testes will automatically migrate into the scrotum. But if testes are not migrating into the scrotum, then we need to perform a surgery called orchidopexy to bring the testes into the scrotum. So what is orchidopexy? A surgery to bring the testes into the scrotum. Because if testes remain at high abdominal temperature for a long duration of time, then the sperm producing germ cells, that is spermatogonia, they will be destroyed. And when such a male baby grows up, he will be sterile. He will not be able to produce sperms. The hormone secreting Leydig cells of the testes are not affected by high temperature. Please remember, it is the germ cells, that is spermatogonia, which are sensitive to temperature. So that was about cryptorchidism and orchidopexy. Sometimes the two testes are fused right from birth. That is called synorchidism. Sometimes there can be a single testis in the scrotum, that is Monorchidism. So these are some of the clinical conditions. Now, as you can see in this diagram, testes are there in the scrotum and they are connected to the wall of scrotum by a connective tissue called gubernaculum. Testes hang in the scrotum with the help of a cord-like structure that is called spermatic cord. Spermatic cord consists of vas deferens, blood vessels, lymph vessels, nerves. So once testes have migrated into the scrotum, these cannot go back into the abdomen because this region, inguinal canal, gets sealed due to formation of a connective tissue. So testes, they communicate with the abdominal cavity with the help of spermatic cord. Once they have migrated to scrotum, these cannot go back into the abdomen. The formation of this connective tissue takes time. Due to improper closure of the inguinal canal, sometimes a loop of intestine can enter into the inguinal region. That is called inguinal hernia. So what is inguinal hernia? Due to improper closure of inguinal canal, a loop of intestine can enter into inguinal region. This is corrected surgically. Is it clear? So this diagram shows you the position of the testes and why testes are there in the scrotum. Because sperm production, maturation, storage requires lower temperature. How scrotum is able to act as a thermoregulatory unit? How scrotum is able to maintain that temperature? Number one, wall of scrotum has large number of sweat glands. This diagram is showing you the wall of the scrotum. So wall of scrotum has large number of sweat glands. Because of that excessive sweating, there is cooling effect. You know, when the sweat evaporates, that produces a cooling effect. Second is, the wall of scrotum has dartos muscles. Wall of scrotum has a type of smooth muscles which are called dartos muscles. And the spermatic cord has cremaster muscles. Cremaster muscles are in spermatic cord. Dartos muscles are in wall of the scrotum. These are involuntary smooth muscles. These contract and relax in response to temperature. Contraction and relaxation of these muscles is able to maintain a suitable temperature in the scrotum. See, if the outside temperature is very low, then these muscles contract. Contraction of the dartos muscles results in wrinkling of the scrotum. The overall surface area reduces. Contraction of the cremaster muscles of the spermatic cord will slightly pull the testes up towards the abdominal area to get the warmth of that area. Right? So when the outside temperature is very low, the muscles contract. Scrotum becomes tight. When the outside temperature is very high, then what happens? These muscles relax. Relaxation of the dartos muscles makes the scrotum loose. Relaxation of the cremaster muscles then results in movement of the testes away from the abdominal region. So ultimately a favorable temperature is maintained in the scrotum because sperm production, for healthy sperm production, the temperature should be slightly low, 2 to 3 degrees lower than the core body temperature. Any external factor which keeps the scrotal area at high temperature, for example, those males who are engaged in such an occupation where the temperature remains high, like the blast furnace workers or those who are working in those factories where the temperature is very high, or a regular habit of wearing very tight undergarments or very tight jeans will decrease the sperm count over a long period of time because scrotal area should remain at a comparatively lower temperature for the healthy sperm production. Is that clear? So that was in brief about the male primary sex organs, that is testes. If we see a sectional view of the testes, inside the testes we have seminiferous tubules. Seminiferous tubules are the structural and functional units of testes. These produce the sperms. Outside the tubules there are Leydig cells or the interstitial cells which produce the male sex hormones. As I have mentioned here, the male sex hormones are the Androgens. Androgen is a category. I told you, androgens include the male sex hormones like testosterone. It is one of the sex steroids. Then it includes dihydrotestosterone. Right? These are the male sex steroids. Please remember, cholesterol is the precursor for steroid hormones. Steroid hormones are formed from cholesterol, whether it is the steroid in the male or whether it is the steroid in the female. So that's all about the primary sex organs of the male, that is testes.